Sleep is the way our bodies heal themselves, and so sleep in someone suffering from cancer is extremely important.
Let's talk about insomnia, because this is the most common sleep disorder and generally the biggest complaint among people with a history of cancer in terms of trouble sleeping. Unfortunately, sleep is not always discussed during medical visits, and so for this reason it often goes undiagnosed and untreated. So it is very important to bring up these concerns with your doctor when you have your medical appointments, even if they don't ask.
Short sleep and interrupted sleep really increase the inflammatory environment in the body.
MD Anderson is the first comprehensive cancer center in the U.S. to establish a sleep disorder clinic. According to Dr. Balachandran, sleep disorders in cancer patients, which include difficulty breathing, seizures, and nighttime habits that disrupt restful sleep, are so common they need to be addressed.
Sleep disorders are very common in cancer patients, and studies that we've looked at have shown that up to 80% of patients with cancer will complain about a sleep disturbance either upon diagnosis or during the course of their treatment. So it's really important that we pay attention to these complaints, as they're major complaints of our patients.
Getting more restorative sleep can improve anyone's quality of life, but for cancer patients, it can have an even greater impact on their treatment. According to Dr. Balachandran, fatigued cancer patients are less likely to comply with their treatment, less tolerant of pain, less able to deal with stress, and at a greater risk of infection because of their weakened immune system. Dr. Balachandran sees the Sleep Disorders Clinic playing a greater role in the future of cancer care as the program matures, helping patients deal with issues that immediately impact their quality of life, but also engaging in research to increase what is known about the connection between sleep and cancer.
You can't just focus on the cancer. You need to treat the whole body. You need to make sure that they're in the best cardiovascular health to treat their cancer. You need to make sure that they're in the best respiratory health. You need to make sure that they're in the best mental frame. And we know that sleep can impact all of those different